Flu season quickly approaching. Are you prepared?
Well, doctors say that now is the best time to get your flu shot and to protect yourself.
That's right. Here with more, Doctor of Physician Practice at OSF Healthcare, Dr. Brian Curtis.
Dr. Curtis, we appreciate you being here. We've got our live flu shots we'll be doing in just a few moments. So.
That's right. But let's find out more about these flu shots first. What exactly are we getting injected into us?
So there'll be 4 strains of a virus. So there'll be 2 influenza A viruses and then 2 influenza B viruses. And so the shots are usually seen about circulating strains that they see throughout the world and the community. And so then they prepare the shots for that.
So why is now the best time to do it? Obviously, we're not in the peak season of colds yet, but I can anticipate that'll come down the line a little bit.
Yeah, so it takes about 2 to 4 weeks for your immunity to build up, and so CDC recommends that everybody have their flu shot by the end of October, and then the flu shot will last 6 or 7 months, so that should carry you well through our flu season, which tends to be between December and February, and so now is a good time to get it.
And do we, from studies or whatever, can we talk about accuracy on these, or maybe not accuracy is the best word, but effectiveness?
Yeah. So last year it was about 35 to 40%. There was a little bit of a change in the virus kind of as it was circulating. But most times it's about 50 to 60%, which I think I would take those odds rather than get the flu. But even when it's not accurate, you still get some protection from the vaccine. So what we saw last year is people that got the flu that didn't get the vaccine were much sicker than the people that got the vaccine and still got the flu.
Well, what would you say about the folks who are like, oh, you're going to get sick after you get those flu shots?
Yeah.
I've heard a lot of that.
That's an old wives' tale. And
Okay.
so, you can get some muscle soreness or feel a little achy after it, and that's just your body's immunity response to it, and so that can be normal. Most people just have a little soreness where they get the shot.
See, I heard after the shot that most people should go home from work.
Huh?
Yes.
Raise his hand. I agree. Can we get a doctor's note on that or sign off on
We do
on
have the
that?
doctor in the house. He can
As we
sign us
vaccinate the hospital, yeah, you'd be short a lot of people.
Now, with the vaccine, is there any difference between giving it to a child, people our ages, an older person, or is it all pretty uniform?
So the recommendation, 6 months and older should get a flu vaccine. And so between 6 months and 8 years of age, if they've never had a flu vaccine before, it'll be 2 doses, about a month apart. If they've had a flu vaccine before, then it'll just be 1 dose. And then everybody over the age of 8 just needs 1 dose.
How often do you recommend getting the flu shot?
Every year, because the
Every year,
viruses change a little bit, and so we need to keep up with the circulating viruses, so we do recommend annual flu vaccines.
And what about the flu mist? Is that still an option?
So the flu mist is back this year, which is an attenuated live virus. It's meant to kind of go in colder in your nose, and so the last couple years they kind of pulled it off the market because what they noticed was the H1N1 or the influenza A strain in it wasn't as effective as it was from the injectable vaccine, so they believe they've changed it, so it is back on the market this year.
All right, good information. Now it's time for us to get our flu shots.
Yes, and we've
Show
got
what
a
goes
little
into
bit
it.
of help. We've got 2 nurses from OSF Healthcare, Morgan Garber as well as Lisa Fay. We appreciate you both being here. They're suited up. They've been sterilizing everything, got their uniforms on. And Dr. Curtis is going to do this with us too. He said he's not leaving us hanging, so we appreciate that. Well, first, I guess go with the gentleman.
The doctor probably first.
The
Give me a
doctor.
chance to.
Oh, okay. Well, I guess we'll actually start with Dr. Curtis and Lauren on this end.
Okay.
So this
Right.
should be good. Now, what are you
Right.
guys' pain tolerance levels?
I don't look.
You don't look.
Yeah, I
don't
don't
look.
like to look either, but I have a pretty high tolerance, I feel.
Okay, not bad, not
Yeah.
bad. I'm sure with you being around this stuff all the time, that can't be too bad for
No,
you.
I just don't look, and then I go like this.
That's
But
a
see,
good
'cause it's on
strategy.
TV though.
You just keep that eye closed, and we'll cover all
Lisa,
the
did you
action.
bring a lollipop for the doctor?
I didn't, not
Oh.
today.
Probably
But
shouldn't
I
have said that.
Maybe he'll
Here
get a
she
cool
goes.
Band-Aid. Take it like a champ, Dr.
Wait,
Curtis.
Is she done?
Don't ask that question.
Now she is.
Yay, Dr.
That was
Curtis.
bad.
Good job.
See?
Handled that well.
Yeah, thank you.
Lauren,
Alright.
on to you. So
Here,
I guess,
I'll,
yeah, that was the strategy not to
My
look on this
sleeve.
one.
Ooh,
should've worn
that
my
was a
sleeveless
that was a
shirt.
little prick. Ooh.
Look at you! Yay, Lauren!
All right.
That was
Very
quick.
nice.
That was quick.
Okay, Mr. Mark, you
All right.
and I
Okay,
guess. is
thank
the,
you.
Is this? I'm pulling this up to
That
the
should
point
be
of
good right
rippage.
there.
Okay.
There's all those.
Now
guns
with
right here.
with an arm like this, do you have to use a thicker or bigger needle to get through all the muscle?
We have an 1.5-inch needle, so,
all the
Okay.
needles, all the time. There you go. All right,
so no worries.
you've got this, Mark.
Breathe deep and
Somebody hold
relax
my
that
hand.
arm.
Okay.
Now, if
relax,
you
relax.
scream, do I get to laugh? That's my question.
The anticipation.
Yeah, I think the strategy of not looking is a good one.
Yes.
Oh, yeah.
Yeah.
Relax that arm.
I'm going to go ahead and clean.
No pain for Mark
No, that-
either.
Wasn't bad at all.
Not bad.
He's bleeding.
I applaud you.
I'm bleeding. That's
Okay.
okay.
And
We'll just hold pressure.
Shelby.
Yeah, just get some super glue to be fine.
Shelby's getting her shot right now.
Got it?
There she goes.
She's a professional.
Eyes closed.
Done.
Yay!
Piece of cake.
Not bad. You guys, we have just done a fantastic thing here. A whole team effort live on TV.
All right, we're going to have this
Wow.
interview on our website, ciproud.com. Just click on the Good Day Central Illinois tab, and you can learn a lot more. Show this to your friends and neighbors that may be scared to get a shot. Doctor, nurses, thank you.
Thank you guys so
you.
much.
Guys.
Appreciate it.